So we know that hypovolemia results in decreased tissue perfusion. And that's one of the reasons that we administer fluids intra-op. There's much evidence in human and veterinary medicine that shows that this increases morbidity and mortality. But what some of the earlier studies didn't consider was relative versus absolute hypovolemia and why that's so important to understand. Has anyone heard of these terms before? Relative and absolute hypovolemia. Absolute hypovolemia is when the body does not have enough circulating volume for one reason or another. Things like acute blood loss, foreign body patients who come in 10% dehydrated, septic patients who are third spacing or maybe have hypoalbuminemia. Relative hypovolemia doesn't mean the patient doesn't have enough volume. It means that the volume the patient has isn't sufficient because of vasodilation. So think about that for a moment. Let that concept sink in. Remember when we talked about what equals cardiac output? One of those was systemic vascular resistance, or how vasodilated or vasoconstricted a patient is. When they are vasodilated, the patient is hypovolemic, but it's relative to the diameter of the veins and arteries, right? So, what causes relative hypovolemia? All the stuff you know about if you perform anesthesia or surgery routinely: volatile inhalants, propofol, decreased circulating catecholamines, things like sepsis. So, both relative and absolute hypovolemia may lead to hypotension. Absolute requires fluid replacement. Our friend, the little 1.2 kilo Yorkie, who is under anesthesia for an enucleation and is starting to bleed out and becoming hypotensive. Get this pup some blood. Relative requires consideration of cause. So, anesthetic drugs and volatile inhalants. Is your cat on like 2 or 3% isoflurane because he keeps waking up and doesn't have enough prescribed for MAC reduction? Phenothiazine tranquilizers. Did the doctor order acepromazine pre-op and it's hitting them hard? Injectable anesthetics, trauma and decreased circulating catecholamines, sepsis, right? So the cat who's had a linear foreign body obstruction that is ruptured and septic needs some norepi. So it's important to remember that vascular tone is gonna be restored at the end of surgery once they've metabolized that volatile inhalant, right? And that's when we can see relative hypervolemia or fluid overload and those associated complications. It's really important to understand that fluid therapy does not correct vasodilation. So if the cause of your patient's hypotension is relative hypovolemia, why would we give fluids? I want to pause here for a moment since I just introduced some concepts that could be new to you. And if any of you have any questions about this, write them down and we'll get to them a little later.